Well, imagine having migraine headaches for over 40 years, trying anything and everything to get rid of the pain.
That was the case for Nancy Graves. After years of searching, she found a doctor right here in Omaha who could finally help ease her pain.
Yeah, Nancy's joining us today along with Dr. Drew Drummond of Spinal Balance Health Center. Welcome to both of you.
Welcome.
Good morning.
Thanks for coming. Happy New Year.
Yeah, Happy New Year.
Last year.
Yeah.
Dr. Drummond, let's start with you. What exactly, when we talk about migraine headaches, there's different causes, aren't there?
Yeah, it is kind of confusing because there's tension headaches, there's cluster headaches, there's migraine headaches, and people try and figure out which one they have. But migraine headaches, typically it's more on one side of the head than the other. It can be in kind of a focused area that continues returning each time they have a migraine. It can have vision disturbances. You can get nauseous when you're getting the migraine, and they can last from a few hours to a few days in the worst cases, and they're just debilitating. People that have them would say it's even handicapping. And from the way we deal with them is we go to a healthcare professional that typically will try and give a medication that will suppress the symptom and make it manageable, or try and identify triggers that make the headache come on, like sleep disturbances, dietary problems, hormonal issues, environmental issues, but very few healthcare professionals are actually going in and saying, okay, here's the problem that's causing this headache. Yeah, so it's hard to treat.
Well, and Nancy, you dealt with this for over 40 years.
Closer to 50.
Oh my gosh, that's a long
Migraines for 50 years?
Since high school.
How did that affect your lifestyle?
You know, it stopped us from doing a lot of stuff. Altitude bothered me, so we couldn't go to the Colorado, to the mountains, flying trips. I always had migraines. We went to Hawaii every year. I always had a migraine when I landed. So it stopped us from doing a lot of things because it was always worrying about, was I going to be able to enjoy it, or was I going to spend the day in bed?
Yeah, if you're in Hawaii, you want to be outside and enjoy
Right.
it. You don't want to be stuck in bed.
How bad are these migraines when you were getting them, and when did they start for you? How old were you?
I was probably in high school, junior high. I mean, probably menopause, not menopause, when I was
Puberty.
puberty, yeah, going through all the fun of womanhood.
Yeah.
And it just, light bothers you, sound bothers you. I mean, I'm a zombie, basically. I'm laying on the couch thinking I don't want to continue.
And you tried treatments for it. What did you try up to prior to meeting the doctor here?
I was a vegetarian for 3 years. I tried supplements, I tried vitamins, I tried caffeine, I tried no caffeine. Food triggers, stress bothered me, weather changes bother you.
That's pretty much everything.
Yes, there's a lot of things you can't
anything and
control.
everything, right?
So you deal with this for nearly 5 decades. I'm sure at some point you've all but given up hope. You've basically said, this is how my life is, this is who I am. You're from Kansas, you live in Kansas, but you hear about Dr. Drew Drummond. How did you find out about him? And then you made the trek up here to visit him.
A friend of mine had heard about NUCCA and for migraines, and I've been friends forever, and so he told me about it. And so within a week I was up here, which was the closest one to Manhattan, Kansas.
3 hours away.
3 hours away.
So you found out about the treatment first, and then you went out and sought out Dr. Drummond.
Right. And since then I've been coming for 10 weeks, and I've had 2 migraines in 10 weeks where normally I would have 20.
Wow.
Well, let's talk about NUCCA Care and Dr. How did you help Nancy? What was the first step like?
The first is to determine if the top bone of her neck is in the right position or not. That's what I correct. Through accidents and injuries, people will acquire upper cervical misalignments, meaning misalignments of the atlas that interfere with nerves. And then once the nervous system is interfered with, that will manifest itself in any variety of symptoms. Migraines, also it affects the posture, so we'll see neck and back issues, things of that nature. But then after we got her in and figured out what was going on with her atlas misalignment that was then leading into the migraines, we corrected the atlas and then got her nervous system functioning better again. And for her, it resulted in the migraines going away, which it does with most people. Yeah.
What she said is about 90% reduction in migraines, which is incredible. Is that typical when you treat migraine sufferers?
About 80% of the patients that come into the office, their migraines seem to be correlating with the atlas, and it can be, I've had some people it's 100% reduction, 90% in her case, sometimes it's a 50% reduction, because that's the confusing part. This isn't the only problem that leads into migraines, it's just one of them, and since about 80 to 90% of the population is walking around with some kind of a misalignment to the atlas, it's the best first place to look. But it isn't always a 90%, sometimes it's a little less. I've had a few that are more, but I've had very few that don't seem to have any effect.
Now, you've been doing this for how long, the NUCCA Care?
11 years.
11 years.
we've been
And
in
is it
Omaha.
hard to find? I mean, we're lucky to have you here. Is it hard to find a NUCCA
isn't
care? I
easy.
mean, she came from
Yeah.
3 hours away.
There's 200 to 300 doctors, it's estimated right now, that are doing this in the world. Most are in the United States and Canada. There's one in England, one in Hawaii. They're kind of spread out beyond that. But it is kind of difficult. So some people will be, they'll live downtown and see that I'm in West Omaha and they'll think, well, that's too far to drive.
Right.
Like, that's in our backyard. We get
Right.
people that have to
Nothing.
come from Kansas to get to us. A lot of Missouri, northern Missouri people, all the way out to Kearney, Grand Island, up to O'Neill. Everybody just kind of comes here. This is the closest.
Well, we just wrapped up the holidays. Nancy, I'd have to imagine that Dr. Drummond is probably on your Christmas card list from
Yes.
here on out, isn't he? Would you
Definitely
recommend
is.
this to other people?
I definitely would. I mean, it's made a difference. I mean, it's just, I have my life back. I can actually plan things again.
Yeah. Well, too bad you didn't find him years ago, but it's good that you finally do that.
And,
yeah.
and the one thing we got to ask you, Dr. Drummond, how do you know if someone is a good candidate for NUCCA care? I mean,
Yeah.
for her, she tried everything.
Yeah, for people sitting at home wondering if this would work for them, if they've got migraine headaches, there's a good chance. If they have migraine headaches combined with neck pain and low back pain, there's an excellent chance. But what we do first when they get into the office, we first look at the posture. I'll measure hips and shoulders, leg length differences. I'll look at head tilt because those are things that are visible that I can see that will come from an atlas misalignment. And then after I see the indicators, we'll take x-rays, which you can see me taking here.
And it's very precise.
Yeah, there's only 3 x-ray machines in the state that are qualified to take this series of films. And then after we get the films taken, then there's a digital analysis that takes place where we actually mathematically figure out how that bone is misaligned. And then it's doing the math, figuring out what force needs to be put back into the joint to move it back into a better position.
Well,
and
and
when
you
that
have-
happens, people get better. Go ahead.
Oh, sorry. For those people who do want to get better, we have a special offer. You always bring in something
Yes.
great for our viewers. The first 15 people who call Dr. Drummond's office will receive a consultation, x-ray, and exam for only $50. And I mean, that stuff adds up, so it's a great
Yeah,
deal.
no, it's a
An
great,
X-ray
great
itself.
low risk way to come in and see if we think this is right for you.
Spinal Balance
Absolutely.
Health Center, you can find them on right in Millard, 142nd Street. Where exactly is
It's right
that?
where Millard Avenue branches off of 144th, kind of by that Stony Brook Hy-Vee.
Yeah.
Right, we're
Well, there's the
close to
website, there's the email, there's the phone number as well. And we'll post this segment online on our website afterwards if you didn't get a chance to see that, but spinalbalancehc.com.
Thanks for
Nancy,
traveling
thanks
up
for
here
coming in.
to
Yeah.
visit our show, too.
Yeah, glad you're feeling a lot better.
Yeah,
That's
Thank you.
great
absolutely.
news.
Thanks,
Thanks,
Doctor.
Doctor.
Thank you. Happy